Good morning, Standard 9 Physical Educations. Today's chapter is Sports, Safety in Sports and Sports Related Injuries and First Aid. What is the sports related injuries? Different injuries will happen different game. That is understanding and first aid of muscles, strain, pulled muscles, torn ACL, torn MCL, shin splint, stress fracture, plantar fasciitis, sprained ankle likewise. The prevention of the injuries, how are we going to prevent? But the area should be clean, neat, and you must wear proper equipment while playing football. Football boots should be the proper shin guard, socks. If you are playing boxing, must wear head guard, gum shield, cricket, abdomen guard, helmet, leg guard, gloves. These are safety measures to prevent the injuries in the sport. This is the most important. Any game you are playing. Now, muscle strain. Muscle injury caused by pulling or twisting of muscles or tendon. Preventions. Proper conditioning during preparations. Advocate to warm up before training or sports activity. Smooth and clean sports area. Complete knowledge about the game. Discontinue playing in case of fatigue. When you are tired, don't do that. First aid. Make the affected area comfortable. Wash with cold water for 15 to 30 minutes. Do not apply ice directly, but wrap it in clean cloth and then apply. In case of excessive pain, take a painkiller or paracetamol. Apply warm water after 5 days. Take rest at least a week. Now, torn ACL, that is anterior cruciate ligament, one of the major stabilizing ligament of the knee, causes slowing down and trying to cut, pivot or change directions. This will happen. Prevention, proper conditioning during preparations, alertness while playing, discontinue playing in case of fatigue. First aid, rest, ice, compression and elevation. This method you have to use. Torn MCL, that the medial collateral ligament, the most important ligament of the knee, causes external rotational forces are placed on the knee joint. Prevention, proper conditioning during preparations, alertness while playing, discontinue playing in case of fatigue. Next, for this first aid, same the rest, ice, compression and elevations. Shin splint, pain in front of the leg between the knee and the ankle. The hockey player will wear a shin guard, football player will wear a shin guard, even cricket player wear leg guard. A different game, different shin guard. They have to protect the shin splint, the shin bone, the very tactically very soft bone. So you have to protect that shin. Use proper protective gear, regular exercise, first aid, resting and icing. Bone injury, these include simple fractures, comminuted fracture, compound fractures, impacted fracture, complicated fractures and green stick fracture. Simple fracture means breaking the bone at one place without any effect of the skin. That is called simple fracture. Commited fracture, breaking the bone at more than one place without any effect of skin and muscles. Now, compound fracture, breaking of bone along with the damage to skin and muscles. Impacted fracture, breaking of bone and entering the broken into another bone. Complicated fracture, breaking of bone and it is dismantling the internal organs. Green stick fracture, breaking or bending of delicate bones of children due to stress. Causes of fracture, unnatural movements, sudden heavy impact, direct hit, sudden fall, osteoporosis, excessive running or walking. Prevention of fracture, educate warm up before training or sports activity, smooth and clean sports area, complete knowledge about the game, eat well balanced diet, wear proper footwear, should not play rashly. First aid steps, give rest to the affected area. If there is bleeding, try to stop the bleeding first. Apply splint to affected area. Splint can be made from wood, plastic, metal, etc. Apply ice. Consult the doctor immediately. Next, plantar fasciitis. Tissues on bottom of foot get inflamed. That's bottom of the sole. That is called plantar fasciitis. Causes excess running, flat feet, overweight. This is causes. Prevention, regular exercise, adequate rest time between running. First aid, rest for few days, apply ice pack on the heels, oral pain reliever, apply athletic tap on foot. Sprained ankle, ligament injury caused to ankle due to falling or twisting of ligament. Prevention, proper conditioning during preparations, adequate warm up before training or sports activity, smooth and clean sports area, alertness while playing, complete knowledge about the game, discontinue playing in case of fatigue, eat well balanced diet, wear proper footwear. Now, first aid, there are two methods of PRICE and MICE. PRICE, it stands for protect, rest, ice compressions and elevations. The MICE, it stands for mobilizations, ice compressions, elevations, followed after 48 hours from the injury till complete healing of the injury. Tennis itself, it is not often is happen in cricket, even hockey, boxing, caused due to excessive gripping activities, regular stretching and strengthening exercises, adequate rest hours, avoid overtraining. First aid, rest for few days, apply ice pack on the elbows, wrist and lower half of the arm. Low back pain, this often is get lifting heavy bucket, heavy weight. Low back pain can happen. Suddenly pushing the two-wheeler, jerk will get. That is called low pain, back pain. Caused due to repetitive and overuse of spine stretcher. Preventions, comprehensive physical therapy treatment, regular trunk stabilization exercises. First aid, apply rice, rest, ice, compression and elevation. Basic physiotherapy exercises. Hip fasciitis, deposition of chalky material on skin lining causes. continuous stress, infection, trauma. Preventions: adequate rest intervals, regular consultation with the physician. First aid: apply mice, mobilizations, ice compression and elevations. First aid: rest, reduced activities for the 48 hours, gradual increase of activities after the first 48 hours. Now, Achilles tendinitis caused due to overuse of Achilles tendon tissues band connecting lower calf to heel of the foot, the backside of the calf muscles. Prevention: no sudden increase in intensity or duration of runs, irregular exercising habits, choose shoes carefully, stretch daily, cross train. First aid: apply price. Price stand for protect, rest, ice compression and elevations. So these are the individuals you have to learn from this for your examinations. So based on question will comes. Good morning class, stay safe, stay home.